Thanks so much for joining me here on Wave Now. I'm Myra Ansari. Today we are talking about Colon Cancer Awareness Month. March is Colon Cancer Awareness Month. It's something that we need to talk about because we're seeing more people being diagnosed with colon cancer, younger people, especially under the age of 50. I think a lot of attention was brought to colon cancer when we lost a famous actor, Chadwick Boseman, to colon cancer. He was in his 40s, just 43 years old. You may know him from the very popular movie Black Panther, and that really shocked a lot of people, made them realize that this can happen to people who are young as well. So today we are teaming up with Norton Healthcare, Sam Simcoff, and he's going to be talking to us about what we need to know, getting screened, the warning signs. Sam, thank you so much for your time today.
Thanks for having me.
So tell us about colon cancer. Why are we seeing more cases for people under the age of 50?
Well, the short answer is we're not entirely sure. The good news is that overall colon cancer diagnoses have been steadily declining actually since the 1980s. But as you say, those diagnoses tend to be increasing in the under 50 population. There are several modifiable risk factors that could contribute. Things like diet can contribute to risk of getting colon cancer. Diets high in red meat have been linked to increased rates of colon cancer. Increased rates of alcohol consumption and smoking is still one of our primary risk factors. That said, there are plenty of non-modifiables, race, age, where you grew up, what your family history is. These are all what you consider the risk factors that you can't modify. And there are so many variables within these risk factors that we're not entirely sure why we're seeing it increasing in the younger population.
Is that a little frustrating for you in the healthcare industry when people say, well, why is this happening? And when, scientists and experts are left, well, we really don't know, but it is happening.
Well, sure. I think it's probably frustrating for everybody, right? Nobody wants to leave any situation, especially one as serious as a cancer diagnosis, with more questions than they entered with. So yeah, it's difficult when we can't quite yet pinpoint why we're seeing these rises. That said, there are plenty of people across the world who are clearly looking into this.
Let's talk about groups of folks who may be at a higher risk. Is there male, female, black, white? Do we have any information on that?
Sure, that's a great question. So as I said before, we do have some non-modifiable risk factors. Males are a slightly more higher chance of being diagnosed with colon cancer, and unfortunately, also a higher chance of dying from said diagnosis. African Americans are actually 20% more likely to get colon cancer, and I believe as high as 40% more likely to die from it. So these are really startling statistics, and they are cause for concern.
So how do we find out? Of course, talk to us about the warning signs and symptoms that you need to be aware of. And we have some resources to help detect this too.
Absolutely. And I'll talk a little bit about the warning signs or lack thereof, and that should lead us to discuss why it's so important to engage in screening. The fact is, once you get into later stages of the disease, you have more of the traditional warning signs. People think of things like blood in their stool, a change in stool patterns. You could have thinner stool. There's a change in your habits, your consistency. And then you can have abdominal pain, bloating, weight loss, loss of appetite, but these tend to be later stage signs. Unfortunately, early on, there aren't many signs of colon cancer, either when it's starting out or even when it's progressing. And for that reason, it's very, very important to screen in a timely fashion. And when I say timely fashion, I mean, typically what the current recommendations say is that for those of average risk, we want you to start screening when you hit around the age of 45. So that's lower than it was in the past at 50, and that's to kind of accommodate for these earlier diagnoses we're seeing these days. There are some exceptions. One of the non-modifiable risk factors I didn't mention before was family history. If you got even just one individual direct family member, say a sibling or a parent who was diagnosed with colon cancer previously, you're going to end up getting screened a little bit earlier. They usually say about 10 years prior to the earliest diagnosis in your family, or 40 years of age, whichever comes first. Now, what can we do to screen and diagnose? The most traditional method that we have is colonoscopy, and it's still what we consider kind of the gold standard. It's where you go into an office and you get put to sleep after doing a day of prep, and they scope your colon. They look at the walls of your lower intestine to see if they can find any evidence of not just cancer, but precancerous polyps or worrisome lesions. Then we have kind of some of the newer, less invasive modalities, such as Cologuard, that we can get into a little bit more if you want to.
Yeah. So you mentioned a colonoscopy, and I want folks to hear this, is the gold standard. That is what a lot of folks should strive to do because it is so thorough, right, Sam?
Correct. It is very thorough. It is very sensitive and very specific. So it's good at ruling out cancers and ruling in cancers and precancers at a rate that we haven't yet met with other modalities. So yes, we do still consider it, the gold standard. Now, the stumbling block that we come across with that is, first of all, because we have been getting a lot more aggressive about recommending screens, there can be a bit of a wait before you can get in to get the scope in the first place. And additionally, it is not without its discomforts. The day before your scope, you have to prep, you have to drink a lot of laxative, which people say doesn't taste very good. And then, of course, you have to deal with the consequences thereof.
And that's one of the biggest, those are the hurdles that a lot of folks, they don't have the time. They either feel like, well, I just don't, it's too much of a process. So we've seen advancements come about to kind of bypass some of that. There's still options out there that are better than doing nothing, right, Sam?
Absolutely. Yeah, doing nothing is probably the worst thing we can do when faced with an obvious danger. So, what we discuss with our patients here more often these days is a newer technology. It's called Cologuard. It's a test that's sent to your home, and instead of having to go through with all the traditional bowel prep and the time and money poured into the procedure itself, they send you this kit through the mail. And I actually have one right here that I can show you.
Yeah, please show us. We'd love to see it.
Yeah, so first of all, it comes in a box about that big.
Where do you get it from?
Right. Well, you talk to your primary care provider and they can order it. It gets sent directly to your address where you live.
Okay.
So it comes with a few components in the box. First of all, it comes with a pretty extensive set of instructions. They're very easy to read and understand. And then all the return labels that you're going to need. Then you have the kit itself. And so you have effectively an airtight container. And this is for, lack of a better term, specimen collection. So you actually hook this up to a little catch that you put under your toilet seat, and you have to go into the container. You do need a stool sample for this test. After that, you actually swab a little bit of that sample and send it in this separate file. But then you seal the container and you send both sealed containers back in the box with the previously addressed or the information to send it back. They then analyze it, and they look at a few different things. They look for presence of blood in your stool and metabolites. They also look for certain DNA kind of triggers that would let them know that you might be at risk for having either a cancerous lesion or precancerous lesion.
All right. I know. Sorry, go ahead,
sorry.
Sam.
Oh, that gets done over the course of a couple weeks, and then we get sent those results by Cologuard, and then we go over the results with the patient.
Okay, so I know there's somebody out there that's like, ew, gross. I don't want to dig into my own, I'll just say it, poop. And, and they're like, that just sounds nasty. But let's be real here. Colon cancer is a lot worse than scooping up a little bit of poop.
Yes, and you're absolutely right. This is kind of one of the hurdles we do have to jump over with our patients is the ick factor of it, right? People do end up getting this in the mail after it's been described to them, and they say, like, I'm not sure. There's a lot of social conditioning that you have to advance past to use it. But you're absolutely right. Given the fallout of a diagnosis that we miss, the cost benefit is pretty clear. Whereas I can see why people might have a difficult time getting in the first place to get scoped. Cologuard really makes the whole process a lot easier.
There is also one thing about Cologuard. Although it is a great option, we had mentioned that it's not as thorough as a colonoscopy. So can you talk to us about what it could possibly miss, or can there be false positives, or how does that work?
Absolutely. And when we talk about Cologuard, the thing I most want to impress upon patients is not so much what we miss as what it really does for us. Sensitivity and specificity are the two terms that we use here. Sensitivity is effectively saying, if this says you don't have something, the chances are you don't have it. It's a high sensitivity. If it's a high specificity, it's saying, if we say you have it, chances are you have it. Cologuard is a pretty sensitive test, which is to say that if it comes back and it says, okay, we didn't find any of these indicators, then the chances are, not 100%, but fairly reasonable, that you can breathe easy for 1 to 3 years and go back and do it again. It's not quite as specific. So the problem is it tabulates a score based on several different loci, from what I understand. And it can be oversensitive in that way. It can say, okay, well, you tripped these 3 criteria, and that doesn't necessarily mean you have colon cancer, but it does bear further inspection. At that point, all we do is we recommend the patient goes back for colonoscopy.
Okay.
So are we scared of it missing something really, really important? Not as much, but there is a chance that it could trigger what we call a false positive.
Okay.
And that just means we have to go back for more tests.
All right. So just to be clear, Sam, that if we do find something in the Cologuard test, the next step is to go in and have a regular colonoscopy. Is that right?
Correct. So really what we're talking about is let's try and minimize the necessity of overusing.
Okay. All right. So there's also some news. NBC News reported just yesterday. If you watch nightly news, you probably saw them talking about a new blood test to screen colon cancer. This is also another positive direction that we are going in to kind of go through the screening process. I know this is new, Sam, but this is something to be excited about too.
Yeah, and it's always nice to hear about new advances with any sort of screening or health tool. I think new is the operant term. These studies are fairly limited so far, and so we need to take them with the requisite grain of salt. The study that was published in, I think, the New England Journal of Medicine suggested a pretty good sensitivity and specificity that at least it's comparable to maybe Cologuard. With one exception, it doesn't seem to be as good at catching, precancerous lesions. That said, I mean, I think we need to wait a little bit to see what more advanced studies show. But it certainly would be wonderful if in a few years we could just add a blood test onto the panel that we might get through yearly labs. I'm fairly certain that would make the whole process a lot easier and more palatable to a lot of people.
If someone has a diagnosis of you have colon cancer, what's happens next? What are treatment options? Can you survive? Like, uh, you know, in the scheme of cancers, which there's so many, like, how does colon cancer rate against everything else in the survival rate and treatment options? Like, if that makes sense.
Sure, no, that makes sense. So the unfortunate news is that it's still around the second leading cause of cancer-related death in the country, which is bad, right? The good news is that mortality rate has been decreasing steadily again since the 1980s. There are plenty of things you can do about it. The key, beyond just modifying those risk factors that we can to avoid it altogether, if one is unfortunate to get one of these diagnoses, we want to catch it early, which is why we screen when we do. And then what we do is we get you in touch with all the requisite specialists, hematology specialists and gastro people. The first thing they do would be probably a surgical excision, depending on what stage that growth is at. And depending on whether or not it has spread to other sites. Now, all that said, I believe reading at some point that the 5-year survival rate now is in the 60s, percent-wise, which, okay, it's not where we want to see it, but it is rising steadily.
Okay. Sam, great information that you provided for our viewers today. Is there anything, Sam, that I did not ask you that you think folks should know about when it comes to colon cancer screening? The biggest thing I think we need to push for folks, if you know how important screening is, colonoscopy is the gold standard. And if you have a family history, you need to start talking to your doctor sooner rather than later.
No, that's a perfect summary.
All right, Sam, thank you so much for your time. I appreciate it. And thank you to our viewers who've been watching with us. Just take care of yourself, eat better, live a healthier lifestyle. That can make a world of a difference for a lot of folks. I'm Myra Ansari with Sam Simcoff from Norton Healthcare. Oh, and I also wanted to mention, in this link, I have attached all you have to do is click on the link, and it'll take you to Norton Healthcare. It'll give you more information on screening options, how you can talk to your doctor, and whatnot, the information that you need to know. All right, I hope you have a great rest of your Thursday. I'm Myra Ansari. Have a great day.